My name is Peter Schneider. I'm a vascular surgeon. I practice at the University of California, San Francisco, and my practice includes both open and endovascular procedures for vascular disease. The paclitaxel RCTs are, of course, we're referring to a number of studies that were performed between the beginning of the 2000s and extending up to the mid 2010s. And in these trials, they were primarily randomized with paclitaxel versus plain devices, either drug-coated balloons or drug-eluting stents. And they were coated with paclitaxel with the intent of improving the patency of these procedures for femoral popliteal occlusive disease. These trials were powered for patency, typically at 1 year. They weren't powered for mortality, and they also weren't powered for long-term mortality. However, the controversy came, and of course the open scientific question came when these trials were analyzed later using a summary level meta-analysis. The demonstration among these trials was that there was an increase in mortality, especially in the long term at 5 years. And there are a number of issues around that. As I mentioned, none of them were powered for mortality. Even together, they're not powered for mortality. And along with this concept of the potential for increased late mortality, we have to think through, okay, well, what are the other issues that would be part of a causal relationship between paclitaxel and long-term mortality? And those issues are summarized in the Bradford-Hill criteria, which are criteria which have been around since the mid-1960s. And it's how epidemiologists very frequently approach an unknown such as this. Is there a causal relationship or merely an association? And those includes things like dose response, biologic gradient, whether or not there's a clustering of deaths, which would suggest a mechanism that a particular agent could be causing long-term mortality. And also, is the signal consistent? That is, if this is a dangerous material, it should be equally dangerous everywhere that it's used, and should be relatively consistent in terms of its causation of mortality